Good afternoon, everyone, and welcome. My name is Molly Mitchell, and I'm the manager of the Mid-Atlantic Public Health Training Center. And on behalf of the Training Center and the Maryland Department of Health and Mental Hygiene, I'd like to welcome everyone to today's presentation, our May Public Health Practice Grand Rounds on Healthy Food Access in Urban Areas, Barriers and Solutions. And before I introduce our speakers today and get started, I've just got a few announcements to make. For those of you who are watching online, I'd like to invite you to please check out some of our archived Grand Rounds that are on our website, as well as some of our other online trainings as well. And I'd like to draw your attention to some of our live face-to-face trainings that are coming up, including grant writing and logic modeling. And just alert that next month's Grand Rounds is going to be on reducing asthma disparities in children. Also, for those watching online, please know that anytime during the presentation, you can email a question to either of our presenters by simply clicking on the link. And we also do ask that you fill out the sign-in form so that we can give our federal funders a better idea of who's watching and how many people are watching today's webcast. And so with that, I'm going to go ahead and introduce our speakers today, Ann Palmer and Holly Friestadt. Since 2006, Ann has been the Eating for the Future Program Director at the Johns Hopkins Center for a Livable Future. She's responsible for directing the food and nutrition work at the center. This includes identifying opportunities to build awareness about the current food system and its impact on public health and the environment, collaborating at a regional level with other institutions to determine the potential of regional food systems reaching underserved areas, working with Baltimore City's food policy director on improving food access in Baltimore, and facilitating community food assessments with community organizations. Prior to this position, Ann worked for 13 years developing and managing strategic communications and large-scale health communication campaigns and programs in Asia. She holds a Master's of International Affairs degree in Communication and Development Studies. And our second speaker today is Holly Friestadt. Holly Friestadt is Baltimore City's first food policy director. In this role, she created the Baltimore Food Policy Initiative and intergovernmental collaboration that aims to increase access to healthy, affordable food in food deserts in Baltimore City. Ms. Friestadt has spent over a decade working on food issues in a variety of contexts, including work on food and health policy as a Food and Society Policy Fellow, and at the Washington State University King County Extension, where she founded a farm-to-school program and developed the program's gardening and cooking nutrition curriculum. Ms. Friestadt also worked for Skagatonians to Preserve Farmland, where she developed a farm-to-healthcare pilot project that provides healthy, seasonal foods to hospitals and retirement communities while creating new markets for farmers. Ms. Friestadt has a Master's of Science from Tufts University in Food Policy and Applied Nutrition and was a Food and Society Policy Fellow in 2007. So with that, I'm going to turn the floor over to Ann Palmer. Thank you.
Good afternoon, everybody. I'm thrilled to be here today, and I just want to thank Molly for inviting us both to come down. As she said, I work at the Center for a Livable Future. We are an interdisciplinary center in the School of Public Health, and we really look at the intersections of public health, the environment, agriculture, and food. And so a lot of our work is looking at the systems, even though today we're going to be talking primarily about healthy food and healthy food access. So why do we even talk about food? And I think one of the things that I've noticed since I've been working on this topic area is that, we have treated a lot of different services in city government, such as water, air, food, shelter, et cetera. Except for food, we have treated those that they need to be attended to and regulated in some way. And so I think one of the things that we see with the increase of diet-related disease is that food has primarily been in the private sector. And we've sort of left it there until certain trends started happening, and we realized that maybe this needed to be considered more as a service or as a good that the public has to have access to. And so I think what you're seeing, there's just been a boon in literature and research and activities going on around the country around food and what's going on with our food system, in large part driven by the obesity epidemic, but by other reasons, for other reasons as well, is that there is an attempt now to try to structure food and to attend to it in a way that we need to do it from a policy perspective and an environmental perspective as well. So I want to talk a little bit about some of the current trends and what has changed in our food system over the past probably, I'd say, 30 to 40 years. And then I'm going to talk specifically about how some of these play out in urban areas. But I think overall, think about going into a store, any store, and it is unlikely that you're not going to find food of some sort. I have noticed food in auto parts stores, libraries, any possible store you could go into has a food display. So we have tons and tons of opportunities to be eating all the time, continuously. We have more food available now than we've ever had available. So really, you don't ever have to be hungry. I think the other thing you'll notice in our food system is that we have an abundance of the types of food products that we are developing. I don't mean different varieties of carrots. This is really more processed food. So if you were in a grocery store in the 1970s, you'd find about 8,000 food products, and now you find about 48,000 food products. And so those are really much more processed foods than we ever had access to before. The other thing that's happened is you see a big increase in serving sizes, and because people are eating out more, that actually has a bigger impact in terms of the number of calories they're taking in. Throughout the presentation, I'm going to talk about what some of the barriers are to people accessing food in urban areas. And I'm going to look at it from a perspective of physical barriers, economic, social, and educational barriers. And where it's feasible to do that, I'm also going to talk about some of the Baltimore-based research that has been generated on these topics. Before I do that, I do want to introduce you to some concepts and just some definitions that we're going to be using throughout the presentation. Food security is really just, do people have sufficient food to live? Do they have enough food? Are they experiencing hunger on a regular basis? If you are a food secure individual, there is some point in the course of a month or a year where you don't have adequate access to food and you're experiencing hunger of some sort. So food security and insecurity are concepts that are generally well known in our field. The other definition is something we call community food security, and this is a much more holistic definition about what's happening at that community level with regards to food. And so you look at not only is there just food there, but what's the quality of the food? Is it nutritionally high in quality? Is it culturally acceptable? Where's the food being grown? Where is it coming from? How's it being transported? How much participation do the people who live in that area have in getting their food? Or are they just going to, this one store that happens to be located, 2 miles from their house? So it really is an attempt to look at what's happening at that community level, and recognizing the household level is important as well, but looking, trying to back up a little bit and saying what's happening in a community with this. And then when we use the term food environment, we're really just talking about any source of food that exists in a given area, a community, we could say, in a geographic area. So it's restaurants, gas stations, food stores, supermarkets, corner stores, anything like that is part of that food environment. So what's the food situation in Baltimore? So I think we have a pretty interesting situation. I'm sure a lot of you have heard the term food deserts before, and I'm going to talk a little bit about that. Holly will talk about that more in detail. But I think what you'll see happening in Baltimore is if you live in a lower income community, that the food that you have available to you isn't necessarily always the best quality. There's a lot more processed food, a lot more fast food, and in some cases the food is also not very affordable. Our food insecurity rate in the state of Maryland has increased pretty dramatically. I just updated these statistics. Used to be about 9%, and we are now up to 12.5%, and that's a steady increase since 2008. And we have households of 5.1% that have experienced hunger on a regular basis, and that was about 3% just a few years ago. So we really are seeing the effects of the recession and the economics impacting people and their ability to get food and to be food secure. And you'll see that we are still lower than the national average, but we're climbing, unfortunately. In addition, you will find that even poverty isn't necessarily a predictor. You find a lot of people living in poverty that are not food insecure, but that definitely is there's this pretty strong relationship. So I'm going to talk about physical barriers now and think a little bit about the built environment and how that impacts people's ability to get healthy food. For each of these bullet points, this is typically a study, one study that's been done. And you can, as you know, for being researchers yourself or people who have studied, that you can, for every study you can find that says one thing, you can find a study that says something else. So you're going to hear some contradictions in what I'm saying, but just kind of bear in mind that this is just to give you some sense of the complexity of looking at these systems. So if you see a headline in the New York Times that says, you know, this is not a problem, this study shows that it's always important to dig deeper and, you know, figure out what are they really trying to measure there, because I think you'll find that there's evidence depending on how you measure it. So this particular study, it looked at if you added a supermarket, did it have a change in the consumption levels and fruits and vegetables of produce? And in one study, they found that it is up to 30% more that consumption increased, and this was among a group of African Americans in a low-income neighborhood. You also find that if you have a low income, you're designated low income and particular zip codes, that you're going to have fewer supermarkets in your zip code. Again, by design, it's more like, and this is more looking at what's the relationship, you know, how often, what's the density of the food stores there. A newer study that has come out breaks this down a little in a little more granular way that I think is really important to look at. So if you don't have a supermarket, and then you do have a supermarket, so you're changing that food environment, that becomes a source, that supermarket is a source for healthier food. However, if you're somebody who has access to a lot of different supermarkets, having more access doesn't necessarily make it a healthier food choice. It makes it somewhat unhealthier. And so you have, then it ends up being kind of a dose response almost. You're getting so much food around you that you're not making different choices. And what they found in this particular study, that if you were now shopping at a supermarket versus perhaps a smaller corner store or grocery, that you were increasing the number of purchases you made for produce. We also have a situation in Baltimore. I think we have 44 supermarkets in Baltimore. Is that right, Holly? So 44 supermarkets. And what we know about those supermarkets is they're very different. If you go to a supermarket in Roland Park and you go to a supermarket in Southwest Baltimore or in East Baltimore, what's inside that supermarket and the quality of that market varies dramatically. And so one of the issues, this research that I'm referencing right now is actually funded by a Center for Livable Future innovation grant. Dr. Franco had published this, and so a lot of the data is going to be coming from that. But what he found is when you looked at the food that was actually in the store, and he gave this a score using a particular measurement tool called the Nutrition Environment Measurement Survey, came up with an index score, and those scores for supermarkets and low-income neighborhoods were about half if you were in compared to a predominantly middle to high income white neighborhood. So it really does make a difference in terms of where you're living, in terms of what you have access to. And even within this, I found rather fascinating, even if you were looking at a chain market, so if you had a Safeway store in Baltimore City and a Safeway that was out in the county, there would still be a fairly dramatic difference in the healthy food availability score. So it is not consistent across chains, and they actually do really market to those neighborhoods what they think is going to sell and what they think people want. If you look at diet, then this is a relatively, this was again from the same data set. I've now since read data that has said this maybe isn't as strong a predictor, but certainly in Baltimore, this was using the MESA data set, which is a cardiovascular disease data set of like 900 patients in Baltimore. And when Dr. Franco looked at this, he found that those patients had a lower quality diet than people, if you lived in a low-income neighborhood and had low healthy food availability, than people who were living in middle to upper income neighborhoods. So again, it's not only affecting purchasing patterns, but it's affecting consumption patterns as well. Now I'm going to talk a little bit about economic barriers and what happens. And as you can imagine, if you're a supermarket, you aggregate a lot of your purchases, and so you have volume buying and you can offer people much better prices. If you're a small corner store, you typically are buying from a wholesaler, sometimes even going to maybe a big box store and buying those items. And so you're going to charge more because you aren't buying the volume that you need to have lower prices. So that's one way of explaining sort of the difference in what happens with prices. But I think even with that, knowing that, there still is probably some price inflation going on that we can see. Brookings Institute had done a study that looked at 132 food products, over 3,000, and found that 2/3 of them were more expensive if you were in a store that was under 10,000 feet. A small supermarket would be about 25,000 square feet. Some of the supermarkets now, they're closer to 50, 60, even 70,000 square feet. So just to give you some sense of size, these are really like more small grocers. And we had used some of the data that Dr. Franco collected to look at what the cost differences were in Baltimore. And we found that up to $1.30 more for a box of cereal, and then a half-gallon of milk was actually about 81 cents more. If you're living on a tight budget, that is a pretty dramatic amount to be paying more for. The other study that I'm a co-author on that's going to be published in the next couple of months is a supermarket study looking at how people make decisions. And when people are factoring in how to shop and where to shop, the other things they are going to cost out aren't just going to be the cost of the food, but they're also going to look at how long does it take for them to get to the store, what's the cost of that transportation. And spoilage and waste is a big factor. If they're going to a store that maybe the quality of the produce isn't so great and it might only last a few days, that can be a bit of a problem. Are you going to buy your produce there, or are you going to just not buy produce because the chances are it might go bad before you need to eat it? So that becomes part of those economic barriers that people calculate in when they're making food decisions. We did a community food assessment in Southwest Baltimore back in 2008, just to give you an idea of how the money gets divided. And on average, this is about 147 people I think that we talked to in the Southwest neighborhood. There were 2 markets there at the time. On average in a month, they spent about $280 at the supermarket, but they also spent about $140 at the corner store, which is pretty significant. So if you think about walking into a corner store and spending that type of money, what food is available to you, it's pretty poor quality for the most part, and there are a lot less options. What we tend to find in terms of patterns of shopping is that people will go once a month, maybe twice a month, to a larger supermarket and do the bulk of their buying, and then they use those corner stores and smaller markets to fill in what they need. And so it ends up being not an insignificant amount of cash when you're on a budget. This is one of my favorite topics, food marketing. And I identify this as a social barrier because I think it does really affects our social norms and how we eat and where we choose to eat. And, I always like to think that I'm too smart to be pulled into marketing and nobody's going to pull it over on me. I'm not going to buy something because they said that. And yet I find myself oftentimes going, oh, maybe I'll just try this. So I think it is not, this has a huge influence on the way we shop and how we shop. And they're spending lots of money gets spent on this to study humans and what their behaviors are. And what we have found, one of the studies that showed that if you looked at shows that were deemed African American in terms of the audiences they were reaching, that they had more unhealthy foods were marketed during that time, and that there were just more food commercials in general. And another study looking at low-income children and how much they watch TV, and that they do have more exposure. And so again, this goes back to the dose response of the types of foods that you're being regularly exposed to from a marketing perspective can be dramatically different. And you don't really see commercials for fruits and vegetables. I mean, there was raisin commercials I think years ago, but that's about the extent of it. We eat a lot of our calories away from home, and because of that, we have to look at restaurants and fast food restaurants, sit-down restaurants, et cetera. I think some of the more robust research we're finding now, because people are starting to realize that we aren't really, yes, there are a lot of people going back to cooking, but in fact, a lot of people still don't cook, and they're spending a lot of money, out. That the fast food issue and the zoning issues around those and the density of fast food has become a big topic to be studied. So these are some of the newer studies that have come out on this. So if you have a fast food restaurant within walking distance, and I think in some of the studies, I'm not sure what the measure was for this first one by Dr. Lee, but in some of the studies they were saying if it was within a mile of your house, you were much more likely to have a diet that was higher in fast foods. So it's just that convenience factor. It's there. You have more opportunities to shop there or buy food there. In general, the other thing we find is that low-income areas have more access to all types of food. And so everything from sit-down restaurants to fast food restaurants to convenience stores to grocery stores. I mean, this is a relatively new finding. So it isn't, again, I go back to the quality of the grocery store. What does that mean? but that they're densely populated with all kinds of food. And so if you look at it from, again, a dose response, you've got lots of opportunities to be eating all the time. And then they did a little bit of modeling on this last study that looked at the availability and what would happen. And it seems as though if you had some kind of, and I don't know how you would do this, maybe Holly has some ideas, but if you have some kind of protective barrier in terms of like how far away should those fast food restaurants be from residential areas, could you actually lower consumption in some cases? And they do think that if you wasn't as densely populated with some of these stores, the opportunities to lower consumption rates could be quite significant. Again, more on the social barriers, what you'll find is disparities between populations. So if you're an African American student living in an urban area, you're going to have much greater exposure than your white counterparts. The chain restaurants in low-income neighborhoods tend to be more unhealthy, and this had to be using what I would consider, there's like a nutrition environment measurement survey that's done for restaurants as well. The restaurant issue gets a little dicey sometimes when you're talking about measurement, because I don't think there's a lot of evidence that sit-down restaurants are healthier, but somehow they've been deemed healthier. I think you can eat probably just as much, and calorie-wise, I don't know that there's any evidence, but there seems to be some understanding out there that perhaps you have more options, and so you would have healthier options than you would at a fast food restaurant. And then the other part of that is the last bullet is talking about the sensitivity to cues and just the presence. They did find that if you looked at low-income residents and having access to all these fast food restaurants, that you had greater exposure, greater opportunities to eat, but that finding actually was really significantly true for men, but not nearly as significant for women. So that's kind of an interesting, and I think this was also, across age ranges, this was true. Women maybe are cooking more. They didn't really hypothesize, but I think that's probably what you're seeing more of. Then just looking a little bit more at social barriers and what happens when we get introduced to certain types of foods at a really young age. So if you're growing up in a neighborhood and you have a lot of exposure to fast foods and unhealthy foods, those tend to be, fried foods, whatever, they tend to be the foods that you know as your food. And that becomes part of your food culture. And it is very hard to change people's food culture. I think you have to be very deliberate about it. You have to have a lot of agency and wherewithal and resources in order to shift, your eating habits. And I think one thing that we don't talk a lot about in food system studies is taste. You get accustomed to certain tastes, and those taste good to you. And let's face it, if you have a bag of chips in front of you and you have an apple in front of you, I immediately go, oh, I should have the apple, but what I really want are the chips. So if you don't have those apples in front of you, maybe you're not even eating those. Maybe it's this kind of baked chip versus a fried chip, that those are the tastes that you begin to know, and they become the ones that you want. And again, that's a really tough thing to change. And I think they certainly know in terms of studies introducing kids to healthier food when they're younger, their ability and their taste buds, they actually become more accustomed to those. This goes back to a little bit more of the social barriers in terms of what we look at in terms of disparities in general. We know that there are disparities amongst low-income populations and middle and upper income, and that can go everything from education and literacy to time available to just daily stress in your life. The less you have sort of a social fiber and a social network around you to help support you in any of your life activities, the less likely you are to probably feel like you have the opportunities to make changes or do things differently. Time, many low-income people are working and sometimes working more than one job. Time cooking becomes a very big barrier. One of the things there, the Thrifty Food Plan, which I believe is used by USDA to help determine food stamp benefits that we call SNAP benefits. And they say that based on what they allow people and what's allocated to them, they should be cooking 14 hours a week. So in reality, most women, if you look at a nationally representative population, cook about 7 hours a week. So that's even a greater disconnect when you think you add the other things into a low-income person's lifestyle and what they're having to do in terms of childcare, and if they don't own a car, they're taking public transportation. The chances of them cooking for 14 hours a week to be able to fill that Thrifty Food Plan are probably pretty unlikely. So that becomes yet another barrier. Then I'm going to talk about educational barriers, and This is, there's some interesting findings with this, and some of these have come out relatively new, but we know that education level does impact how people choose to shop and what they choose to buy. What I think is probably less clear is that which comes first. Is it because those unhealthy foods are there and they're cheap? And just how cheap is cheap? Do they have the extra income to spend more on healthier whole foods? So it's not clear really, I think, what direction that's going in. So yes, they have unhealthier food purchasing patterns, but what's actually driving those purchasing patterns? And I think there's a lot of things that drive it. We also know that if you give people a little bit of education, nutrition education around food choices, that they do make different choices, and they do a lot. They change shopping patterns. They're more likely to try new foods. You're increasing purchasing and consumption. You see increases in consumption, but that isn't necessarily going to always be enough because there are a lot of other things that factor into how they make their decisions. And I think one of the things we're learning on this supermarket study is just how complicated it can get, and where are those levers that you can push that are maybe a little bit easier to tip it over that line versus something that's going to be a very dramatic shift. Can you get people to purchase entirely new types of food, or is that even necessary? Is it more about what's a healthy, affordable food, and then how can they take that food and create a healthier meal versus you need to buy a lot more of these foods that you've never tried and maybe aren't as familiar. So there's probably a sweet spot in there that I hope we're going to find with our supermarket study. But right now, I think we know obviously information is not enough. It really needs to be more. And then this, I think I've kind of covered already, is just that, I believe environments really do have a lot to do with, how people choose to shop. Even if you walk into a store and see what's immediately available to you, what's available at eye level, what's available at the cap aisles, all of those are very strategically located within a store to make you want to purchase those items. Most of the time, those items are not healthier food choices. And if you're in a neighborhood that already has a supermarket that isn't selling particularly a lot of healthy food, you're going to be prone to it. You're going to see a lot more food items in there that are not healthy. And so your opportunities, again, are going to be much greater than if you're in a supermarket that doesn't have as many of these processed food products. And then last, this other, I think, is just, I've covered this, is just what the strategies that people use to kind of overcome these obstacles. And our paper hasn't been published yet, but it'll be coming out soon, so hopefully I'll be happy to share with anybody who's interested. But this does really look at, from a qualitative perspective, how these decisions are being made. And so I think that's the end of mine. I'm going to turn it over to Holly, and I hope giving you guys some appreciation for just the system that's in place that makes our food choices difficult. There we go. Makes it difficult for people in low-income areas. So thanks.
Thanks, Anne. You set me up very well for this next presentation. So I'm going to talk about the Baltimore Food Policy Initiative, food deserts, and food access solutions. So I want to first give you a quick overview of the Baltimore Food Policy Initiative. So to start, Baltimore City has an Office of Sustainability, but we also have a sustainability plan. In our sustainability plan, we have a goal, greening goal number 2, I refer to it, establish Baltimore as a leader in sustainable local food systems. To me, that alone is quite innovative. That here in a city, in an urban environment, we have a goal to have a sustainable local food system. My favorite slide I like to use, food system is a word that many people are starting to use. It has some jargon to it, but I really want to define it for the context of today's presentation. This is from the Mott Group from Michigan State University. It's still my favorite diagram, and I would like to use Great Kids Farm as an example. Great Kids Farm is a farm owned by the Baltimore City School District, and it's around a 30-acre farm with around 5 or 6 acres in production right now. And I'm going to explain the food system through this farm. So the kids grow organic produce. So you're looking at the inner circle right now. And then it creates jobs. Kids are learning how to grow food. They're learning how to then sell at the Waverly Farmers Market, where they accept SNAP benefits or food stamps. which is creating healthier individuals. So in this model, we're looking at one example of how a farm and kids are creating a local sustainable food system. Okay, so within this plan, our goal related to food access is to improve health outcomes by increasing access to healthy, affordable food in food deserts. I want to spend a moment to define food deserts. And the work that we're using in Baltimore City on food deserts is really because of Johns Hopkins School of Public Health and Center for Livable Future, and Anne and all the folks in her shop. Around 3 years ago was the first definition of a food desert and the first level of maps. Since then, we've been working together to come up with a food desert map and definition that really resonates and takes into consideration the food environment. Now, as Anne was mentioning earlier, there's different stories or studies saying that this is good or this is bad. You may have seen in the New York Times several times now about food deserts and some thoughts and questions on those issues. What we have found with our work is initially the initial definition that Johns Hopkins had was really a binary approach, which is how far away is a grocery store and is in a low-income area. And that is currently the USDA food desert definition is that. They're saying 1 mile from a grocery store and a low income. Now, what we've decided in Baltimore City that indicator will not work well for us, and that we have 4 key components to our definition. For Baltimore, a quarter mile from a grocery store, because that is the most people are likely to walk. And if it was New York City, you might have a different definition as far as distance. Our public transportation, I think there's more to be desired, and that we need to take into consideration walking and how long buses take and so forth. So we included the low vehicle availability, low income at or below 185 federal poverty level. But this is the most interesting piece, and Aaron already alluded to this, low healthy food availability score. So with Center for Livable Future, they went through and scored and did a healthy food availability score for every food retail establishment in Baltimore City and gave it a score. So just so you understand, it is an index score, but a corner store or convenience store will have a low score somewhere between 1 and 7. A full-service grocery store somewhere in the high 20s is your range. And so the reason why this measurement was very important in our new definition is that we want to understand that the food environment impacts health. So what Anna was already talking about, there's 164 corner stores and convenience stores in Baltimore City's food deserts. By definition of a food desert, there's not a grocery store within a quarter mile. So where are people going to eat? What's convenient and close to them? With not having a lot of time on their hands, making that assumption, they're going to eat where the food is. And so that was another piece that we really wanted to think about. And so we're working with USDA in their revisions and drafts for the next definition of food deserts, because big cities, and Baltimore, with a population of 625,000 people, but I mean Boston, LA, New York, Chicago, some of these bigger cities as well, are having the same findings as we are. When you look at the USDA food desert locator, we don't really have any food deserts according to that map, because density isn't always taken into account. And so we're working with USDA to really look at how can these cities that have a lot of food deserts and food access issues be represented on their USDA map. And they've been a great partner as we've been developing and working through those issues. So as far as what does food deserts really mean to Baltimore, 20% of the city residents live in food deserts, 120,000 people. That's 1 in 4 kids live in food deserts. What I thought was interesting in the most recent analysis of this map, approximately 83% of the residents are employed. I thought that was interesting. Being in a food desert, and by definition of a food desert, we're talking low income and poverty areas, meaning that we really need to be taking into consideration underemployment and the fact that we need to create more job opportunities in this area as well. And it's maybe that people are already working 2 or 3 jobs, so higher paying jobs. And this last number is something I need to continue researching with Johns Hopkins on this one. Our numbers for SNAP benefits in food deserts was 24.5%. I really expected to see those numbers in food deserts much higher. So that's a new figure we just started to unravel a few weeks ago, and we're going to dig a little deeper into that one of why. So the Baltimore Food Policy Initiative, as far as the organizational structure goes, as we know, food intersects many government agencies. It's not like there's just one agency in city government, state government, or federally for that matter, that all food is related to. It's in transportation, it's in health, it's in planning, it's in economic development. It intersects so many agencies. So that's why we have the Baltimore Food Policy Initiative, which is really 4 agencies. It's a Baltimore City Planning, a Health Department of Sustainability, and also the Baltimore Development Corporation. They're the 4 key lead agencies. But we understand that government alone cannot solve the issue of food access. And so we have Food PAC, Food Policy Advisory Committee. It's Baltimore's equivalent to a food policy council. And it is growing. It has 60 members currently. It's 35 organizations represented. My goal is that every organization in Baltimore City that has anything to do with food access, nutrition, gardening, cooking, health will be a part of Food PAC. They are not a decision-making body. The goal of this is to be able to help implement the 10 Food Policy Task Force recommendations, which I'll talk about in just one second. And one thing I realized, I was born and raised here in Baltimore, but I was out in Washington State for 15 years and just moved back around 2.5 years ago. I realized coming back to Baltimore that there was a lot of silo work. There was a lot of great work happening here and a lot of great work happening here, but they didn't know about what each other was doing, and everyone's trying to work on bare-bone budgets here. And so one of the goals with Food PAC is really increasing collaboration among Food PAC members. Okay, here are the 10 Food Policy Task Force recommendations. Prior to my hiring on my position, so it was 3 years ago, the mayor at the time, Sheila Dixon, said we need to establish a food policy task force. So the planning department and the health department became the co-chairs. Ann Palmer was actually one of the key leads on this task force as well, and developed out with 18 key stakeholders the 10 key priorities for Baltimore City as it relates to food access and food issues. And so when I came into this role, this was sort of my worldview. I came in not needing to figure out what to do, but here are the 10 and sort of the timing and the details related to these 10 issues. Okay, so now I'm going to move into more details related to the food policy task force recommendations. So I have 3 key areas I'm going to talk about related to this. The first one is around healthy food retail and food deserts. Okay, so the virtual supermarket. One of the goals, with the First Lady and Let's Move is to eliminate food deserts in 5 years from now. And we know that building grocery stores is very important, the brick and mortar grocery stores. But we also understand that it takes, if you're lucky, 5 to 10 years to get a grocery store into a neighborhood. There's a lot of costs, a lot of loans, a lot of logistics and expenses to do so, and we need to do those. But there needs to be things we can do now. We need to be able to bring food access into communities now, not 10 years from now. So the virtual supermarket is a really innovative solution to that. The health department runs this program. Its history started in the libraries located in food deserts. It's a private-public partnership between Santoni's, an independent grocery store, and the health department. And so Santoni's already had an online ordering system, a web-based system for ordering food. And so what the goal here was that you could go to a library at first, and then there'd be a health department coordinator there who would help you order your food online. They'd provide a computer, they would put the food in, order the food, or over time they realized that there was a lot of people who had their own computers and they wanted to order their food whenever they wanted to and not have to come to the library to order the food. So they got a promotional code, and then now today, if you're anywhere, a public computer or private computer, you could go online and order your food, and then once a week pick it up. And so that was really the beginning origins, was starting with libraries. As of probably around 5 or 6 months ago, they've expanded that model, and I really believe that this is the model that has national ramifications. Right now they have expanded into senior and disabled public housing. And by the end of the summer, they will also be in family public housing, which is great because, our public housing could have from 100 units to several thousand units. And the convenience of just being able to go into your lobby, order your food, and then pick it up down in your lobby is way more convenient. It's really hard, as Ann already mentioned, to change food purchasing habits and food behavior. People have a hard time thinking of going to the library to order food. It was innovative because the libraries are all throughout food deserts. They're very easy to access. They're walking. It's a really innovative solution, and we're continuing with the libraries. But I think public housing and really understanding convenience is key here. And that we know with this strategy, it needs to be pooled ordering. So it's not a matter of like a Peapod or a model just going from door to door to door. We'll be able to bring in the amount of money, but when you have the pooled ordering at one site and there's 10, 20, 30 orders per week, it can be a very viable option for grocery stores. With this being said, Baltimore is the only city in the country right now that has this model, and there is a reason for it. Santoni's, our grocery store, independent grocery store, is willing to take payment at the time of pickup because there's 26 federal policy barriers prohibiting online use of SNAP benefits. So, a large grocery chain is not going to be able to take an order, go get all the food together, and then bring it to a site and then take payment. What if people don't show up? Now, we like to use the analogy here in Baltimore. How many of you go to a grocery store, fill your cart full of groceries, and walk out? You've already invested so much time, you don't do that. And that's what we have found in Baltimore with the virtual supermarket. So it's not really an issue for Santoni's, but if we're really going to address food deserts nationally, that the virtual supermarket has a national implication for it. But we need to, and we are working with USDA. And actually, I think it's in the language for the Senate for the Farm Bill. They mentioned online SNAP pilot projects through FNS, Food and Nutrition Services, which we're hoping that Baltimore could be one of those. So we really do want to see this become a national model. Okay, public markets. We're one of the only cities in the country that still has many public markets, a whole public market chain. And when I mean public markets, I'm talking about covered historic markets. We have 6 of them in Baltimore City. I'm not referring to farmers markets. I'll get to that in a few minutes. So these were our historic markets, before the times of grocery stores. They were where everyone came to sell their foods and goods and where everyone shopped. Over time, the public markets reflect their neighborhoods that they are housed in. And so we have 6 public markets in Baltimore. Lexington Market is the largest and most well-known market. And what we have found, we did a healthy food assessment of these public markets about a year ago. And there was 2 key findings we found. 1, 4 out of the 6 public markets are in food deserts. 2, 70% of the food in the public markets are carryouts. Baltimore, we use the word carryout. We don't use the word fast food. Carryouts are more independently owned restaurants, whereas fast food we refer to as more a chain restaurant. But they could be interchangeable if you think about it nationally. So anyway, it's prepared foods. So 70% of the food in the public markets are prepared food. And so what does that really mean? It means that our public markets, where we're in food deserts, is contributing to the density of prepared foods and unhealthy food choices in our food deserts, where there's an absence of grocery stores. So we took this really seriously and want to see how could we figure out a solution for our public markets. And so working very closely with Joel Gittleson and Sung-Hee Lee with Johns Hopkins School of Public Health, they've been doing prolific research on healthy carryouts and healthy corner stores. And we took their research tools, and their researchers for that matter, I've been working very closely with them to take their model and apply it to the public markets. And so we developed out a healthy carryout model where we currently have piloted 10 carryouts in Lexington Market. With our more recent funding from Kaiser and Able, we are now expanding into 22 carryout vendors at Lexington Market, 8 carryout vendors at Northeast, and it looks like we'll be going into Holland's Market as well. And the goal here is to work with the current retailers. That's very important to start with, is that there's 2 strategies. The first strategy is we already have carryout vendors in the public markets. We want to work with our current vendors and help them sell healthier foods and make money selling healthier foods. If they can make money selling healthier foods, they will sell healthier foods. And what our assessment showed is that over 50% of them on their menu or in their contract said they were going to sell healthier food choices, but they were not currently selling them. And so we asked them, on your contract, it says that you're going to sell these foods, and why aren't you? They said, well, I tried selling them, no one buy them. And so it's not a matter of just one carryout at a time trying to figure out the demand issues and trying the new foods. But if we can have many carryouts at the same time working on the issues, we could really start to move the needle on the issue. So we have these 10 carryouts. We've done an analysis of their menus. We actually gave them menus where we're highlighting the healthiest foods relative to their menu. We're making an assumption here. The assumption is you're standing in front of the carryout and you are buying food. You're eating lunch here. And if you're eating lunch here, how can you choose the healthiest food on that menu? And so that we launched with the mayor and Dr. Perman in a press conference this past spring. And that we've been getting some really good feedback on those issues. But we understand that a carryout strategy alone is not going to be enough. We really need to increase demand for healthy food purchasing. We're looking at doing that. I mean, one is through cooking demos and nutrition education, of course, but it's also looking at financial incentives, meal deals. And Reading Terminal in Philadelphia has a great model for meal deals, $7 meal deals. And the goal here, remember, is to drive more people to buy the healthier food choices at the carry-out vendors that we're working with so they can start to see they can make money off of this. And so the meal deals will help increase incentives towards that. And the third part is really to increase more local farms and local vendors in the public markets who are preparing, whether they're making their own food, growing their own food, or making their own crafts and arts, to have that represented into our public markets. Right now, they're not really well represented, and we want to see a change on that. And the third area, which is really the one you hear the most about nationally around addressing food desert issues, is bringing in grocery stores. So Howard Park Grocery Store is a grocery store that we've been wanting to see a grocery store in Howard Park for a long time, for over 10 years now. We received healthy food financing funds, federal funds for around $760,000 to help make this grocery store happen. It is going to be a ShopRite. It's actually Jeff Brown's ShopRite with Klein Family Markets. He's done quite a few of the grocery stores in Philadelphia and food deserts. It's a really successful model. We're looking forward to seeing it here in Baltimore. And what makes it successful is one key thing is that they invest a lot of money in job training. And they really try to employ people from their neighborhood, train them well, and have them be working in their neighborhood through the grocery store. This specific proposal is we'll have a commercial kitchen. There's an elementary school across the street, and Chef Connie, and she has been doing catering with her kids this elementary school. And the kids just actually catered an event for the mayor and the governor a few weeks ago on the launch of the HBO salad bar program. And it was amazing, but they really do need a kitchen. A larger kitchen, and so there's going to be a commercial kitchen in this grocery store for them and for other food entrepreneurs. Okay, so I just talked about sort of the healthy food retail piece. Now I'm moving on to homegrown Baltimore, grow local, buy local, eat local. The mayor actually titled this herself, and the goal really is how to grow farmers and how can farmers sell their food and create a local food system here in Baltimore. So to start, the first part is around supporting urban agriculture. This is one of the Food Policy Task Force recommendations. We're a city that will be growing very soon, but for the last decade or so, we have been more of one of those shrinking cities. So as a result of that, we have a lot of vacant land. And so we did a vacant land assessment and looked at, can any of this land be used or conducive for urban agriculture? I need to take a moment to define urban agriculture because everyone defines it differently. And I think we in Baltimore City are defining it very specifically, so I should define it for you. So when I'm talking about urban agriculture specifically in Baltimore City, we're talking about farmers who are trying to sell for production purposes for sales. I'm not referring to community gardens right now for the sake of this conversation. It's really those who are trying to be full-time farmers or trying to make a livelihood off of farming. And so we looked at this vacant land assessment, saw around 20 acres or so that would be conducive for urban farming, or that we thought would be conducive for urban farming. We did a national lit review around the country, if I remember correctly. Center for Livable Future was very instrumental in helping us do that lit review to figure out all the other cities and entities that have done a request for qualifications for urban farms on publicly owned land. So then we put together a request. We had 10 farmers apply, 5 farmers pre-qualified, which was important for me for 2 things. One, it made me realize that we have to have a farmer training program in the city. So we partnered with Future Harvest, and they're doing an urban farmer training program so that we would like every farmer who wants land to have land, and they need to qualify. So we want to make sure they're trained and are able to qualify. That was number 1. Number 2 is, so now we have these 5 farmers, and we're working with them on finding the most appropriate land for them to farm. And through this process, this 20 acres or so, what we realized is that the farmers who are trying to make a full-time livelihood on this needs the very best land possible. As we know, nationally, it's hard to make a livelihood off of farming. And then add it into a city, and they really need to have the very best start possible. So we're working with them to find the best land. And in the meantime, we realized that we needed to develop out sort of a new kind of farming in the city, the market gardener. So it's the person who had their own community garden, or they had their own plot of land. They really like growing food. They're growing more and more and more, and suddenly their family and friends can no longer eat all their food they're growing, and they want to sell some of it. And so we're really looking at creating that opportunity in the city through some of these smaller plots that we have, less than an acre, for our market gardeners. And then obviously we have well over 100 community gardens in the city, and we want to support their efforts. And one of the ways that we're supporting their efforts is, up until around a year ago, they were pretty much, I think it was a 1-year lease, and they had to keep renewing every year. And now we're moving many of those into 5-year leases to give them a little more stability. So that's one area around sort of urban farming. Another piece is that we have our proposed land use zoning code that we've been working on. And in our current code, it made it so that farming was not permissible in the city. And that's why we didn't see any farms. We saw an example of Great Kids Farm and Real Food Farm because they were on school land, and that was okay. So in our proposed zoning code, that we made it permissible, 1, to farm, and 2 is like if you have a community garden and you want to put a farm stand out to sell your extra produce, you can now. So we're trying to make it easier for farmers to grow and sell their food in the city. And then there was sort of the whole high tunnels. You see here, it's an example, from the hoop houses, or we call it hoop houses or high tunnels, is that we started to see more and more and more hoop houses popping up literally overnight in Baltimore City, and realized, we better change our building code, because the building code hasn't been revised and it has no language to high tunnels or hoop houses. So we changed the building code so that it's permissible to have hoop houses in the city as well. And the last point I want to talk about is animal husbandry regulations. In all honesty, this was we were really fortunate on this one. We've seen and watched cities all over the country struggle with sort of the changing of animal regs. How many chickens can you have? Can you have chickens in the city? Can you have more than 4 chickens? And it could go on forever. In Baltimore, it was a week, because what happened was that the health department it's a regulation. It's not a health code. Because they had an animal regulation that they were reviewing every so often, every so many years, that we realized that they were going to be reviewing it and said, hey, you know what, could we look at this regulation and see what's in here, and could we put some recommendations of what we would like to see? And so we looked at it, and it had 4 chickens to start, and we were able to change that regulation from 4 chickens to 10, space dependent. Same with bees. We went from, I can't remember the details of how many beehives you could have, but it went from maybe 2 up to more, depending on the amount of space. And then we also were able to include rabbits and miniature goats into the animal regs. And it was really just a very nice, quick one. It's always nice to have some nice low-hanging fruit. So that's really the support urban agriculture piece of Homegrown Baltimore. Moving on to sort of the market share piece of buying and eating local food. Baltimore City has 20 farmers markets. As with the national trends, we have actually 8 machines that have EBT machines at farmers markets. It's 7, but I'm counting July 1 is coming up so soon. I'm counting it in my number. Our largest farmers market, Baltimore Farmers Market and Bazaar, has received funding from Kaiser Permanente to have SNAP benefits offered this summer. And we have received Baltimore bonus bucks or double incentive dollars to incentivize those who are on SNAP benefits to come to the market. And for every $10 they spend, up to $10, they can get $10 more in produce or in food eligible for SNAP benefits. What we realized, we did a farmers market assessment, and pretty much my conclusion of this lengthy assessment was if you wanted to set up a farmers market in Baltimore, good luck. Because the regulations that we were putting forth in the city, it wasn't that they were any more than anywhere else in the country, but there was no guide. No one was saying anything consistent of, okay, you want to set up a farmer's market? Here's your guide. This is who you need to talk to. This is what you need to do. It should take you X amount of months. You just need to get this in by this time. Pretty much, it took me a long time to figure it out because I had talked to so many different people and got so many different answers and realized that all we really needed in the city was a guide and to simplify some of the permits and how the permits were organized. So we're trying to make it easier to set up a farmer's market in Baltimore. And I think those are really the key pieces related to farmers markets. And the last area that I want to talk about is around healthy eating marketing campaign. As Anne was talking to about marketing and how marketing of foods really influence our food behavior habits. We had a one-year grant in collaboration with Associated Black Charities and Fox 45, and Kaiser was the key funder for Get Fresh Baltimore. And the initial goal for Get Fresh Baltimore was really around public service announcements. And we have these great 5 public service announcements. And by the way, this whole PowerPoint is hyperlinked. So if you click on the top of every slide, you will then go into more detail and you can see the 5 public service announcements. So these great 5 public service announcements on where to eat and get fresh fruits and vegetables, whether it's a virtual supermarket, farmer's market, Great Kids Farm. But we realized that we could do so much more than just public service announcements. So we collaborated with University of Maryland Extension and the school district, and we had 2,000 elementary kids create fruit and vegetable ads. We then took those ads, and with the support of the mayor's office and free ad space on the buses, we had 250 of the kids' ads, individual original artwork in the buses. It would have been way cheaper if I just took one of the best piece and make it an art contest and take that and multiply by 250, but that wasn't the goal. This goal was not about an art contest. It wasn't about one kid, having the best piece of artwork. This is about having 250 kids influence and be proud of creating an ad that can influence people's behavior choices. And that's really the goal. And that's why we had 250 individual ads in the buses. So they were on the inside of the bus, they were on the outside of the bus, they were on the light rail, the metro rail, and so forth. And we have 7 key messages. You can see 3 colors. Each color is a message. Get fruits and vegetables at your virtual supermarket, get fruits and vegetables at your farmer's market, goes on to grocery stores, schools, public markets, and so forth. And this was such a great, successful campaign that as a city, we're now using their artwork and the Get Fresh Baltimore message for all our healthy eating campaigns in the city. And then moving on to Baltimore City Schools. We're working with the school district around healthy foods in the schools. We established a Green Schools Network. It was called Sustainable Food System Action Team. And the goal there was to have everyone, once again, it was around a collaboration issue. We realized that there were so many different partners in the school district. That one school had this organization doing gardening, another school on the other side of the city had this great nutrition education class of extension coming in, but there really was not much coordination or collaboration of what strategies are being used in the school districts and everyone knowing what everyone else is doing. So that this team is really about increasing collaboration of nutrition, gardening, cooking, education in the schools. In addition, we have the Healthy Food Challenge Grant, where we had 11 schools write mini grants for $1,000 for a healthy food initiative in their school district. We're going to be having a celebration of their work in the next month. Let's Move salad bars, as you guys saw, hopefully all of you guys saw last night on HBO, Weight of the Nation. As a part of the Weight of the Nation, HBO, I think it was on May 1st, gave salad bars to, I think it was 20 school districts. I can't remember the exact number of 20, but I know we're one of them. And so Baltimore City School District received 10 salad bars. And that's really helping to launch our salad bar initiative. That brings us up to 20 salad bars in Baltimore City School District. Our goal is to have a salad bar in every school. In addition to that, we have the fruit and vegetable program. Last year, we had approximately 20 to 25 schools participating. Now we have 86 schools. And we really wanted to create a farm-to-school movement within that. So Great Kids Farm actually grew the microgreens and carrots for the fruit and vegetable program. I want to sort of set very quickly, before I conclude here, sort of the national perspective on food policy. So when I came in, I was probably one of several, definitely less than a handful, of food policy. The positions may have different titles: director, advisor, coordinator. But anyway, the key person in the city related to food access. And so with the assistance of Wholesome Wave, we developed out the Food Policy Director Network. To date, there's 10 cities with the equivalent of me included. So there's 9 other cities. So that's grown quite a bit in the last couple of years. And the goal really is that what we found is that even though we're all in different cities and our cities look very different, we're dealing with the same issues. So there's a lot of collaboration happening. But what I think is most exciting is the United States Conference of the Mayors established a food policy task force. Mayor Menino in Boston is the chair. Mayor Rawlings Blake in Baltimore is the vice chair. This was just established this past January in DC, and since then we've had a meeting in Boston a few weeks ago for our food policy, and we have already tackled quite a few issues. There's been several letters that they've written for the Farm Bill. And we've been working on the food desert locator definition, online SNAP benefits, and that this has been this is really one of the first times the mayors have taken a voice and a stance on the Farm Bill. And this task force had a lot to do with the mayors coming with a collective voice to talk about the Farm Bill. With that being said, when we started to think about cities and Farm Bill, I was wanting to make sure that the city was really thinking about the Farm Bill. And so someone in the policy shop said, well, how much money does Baltimore receive from the Farm Bill? I said, well, that's a really good question. Let me figure that out. So Baltimore City, a population of 620,000 people. So just imagine New York, okay? But Baltimore City, 620,000 people, we receive over $1 billion on the Farm Bill. And that is for SNAP benefits. That's also, though, has been very important for our ag issues, for our community food projects in the city. And when you hear and think about SNAP benefits in the Farm Bill, you immediately go and think about those people on SNAP benefits who need to go to a grocery store to use the SNAP benefits. What we forget to realize are how much money our grocery stores are getting income from SNAP benefits. So if we're seeing huge reductions in SNAP benefits, it's not only impacting the individual using their SNAP benefits, it's impacting the retailers as well. And we did interviews with grocery stores, and one of our grocery stores located near a food desert, 80% of their sales come from SNAP benefits. So it's just a very interesting perspective to think about on both sides of the coin related to SNAP benefits. And that wraps up my presentation. Thanks so much.
Great. Thank you, Holly. Thank you, Anne. At this point in the presentation, we will now be able to take questions for both of our presenters. Yeah, if you guys could join us on stage, that would be great. And just a reminder for those who are watching online, just click on your link on the screen and you can send in emailed questions to either of our presenters. But in the meantime, why don't we start with our live audience here, if anybody has questions for Anne or Holly. Yeah. Oh, and if you could just wait for someone to come with a mic so everyone online can benefit from your question.
Hi, thanks for your presentation. It's very promising. I have a few questions lingering in my mind about farmers markets and also community garden. So as I observed, or I did some field trip visits, most of the farm owners are white. And I was wondering if there's any African Americans who owns a farm. And this might be better they might be better in developing relationship with the African American community, thus increasing fresh fruits and vegetable consumptions among them. And also, is there any best practice guideline for plants growing for the community garden so that they don't need to start from scratch? You want to promote community garden, right? So it's going to be frustrating if they don't have any best practice guideline to refer to. And also, I'm also thinking, is there any regulations of the safety concerns of the farm stand? Because food and waterborne disease really taught us a lot about the contaminations of E. coli and pesticides and others. Thanks.
Okay, sounds like I think those all three were mine. Maybe I'll share one with you. I'm going to start with number 2 because that's a really quick, easy one. The second one you were mentioning was around community gardens. Is there a guide? Parks and People, which is a nonprofit in Baltimore City, has really been the lead on community gardens, and you should go to their website. It's a great resource. Also, the University of Maryland Extension just hired a sustainable ag specialist to really support community gardens and other growing experiences in the city. Going to your first question now on farmers markets. Going back to the farmer training program, what we have realized is we want to see, we have all this vacant land, and for the most part, the vacant land is in food deserts. A lot of it's in food deserts, and as our food desert map showed us, most of it is, are the residents are African American. And so our ideal is that we would be having African American residents, or any residents living in food deserts would be the ones who'd be applying for this land to be able to grow food for themselves and then also to be able to sell as well. In this request for qualifications of 10 farmers, I think we had 3 African American farmers who applied, but I really would like to see, our farmer training program being part of a housing authority and a part of really reaching out to the communities that are living in food deserts so that they are having, maybe this is one of their extra jobs to help grow food. So our goal is to make sure, or hope, that we can provide the resources so those people living in food deserts would be the ones who would have access to growing the food on the vacant land. Since this initiative is relatively new and we just did our first year for the request for qualifications, we knew that our first year coming out, how we wrote the qualifications, you had to have a year experience farming and you needed to have a business. And so we knew by those qualifications, because this is a business agreement with the city, this is not community garden, that we were going to most likely have farmers from the outside coming in. Outside meaning it could be Baltimore City, some other part of the city, or the county, or even another area. Like we did have one resident move from DC to Baltimore, now has bought a house and is now growing food in the city. So our goal is to diversify the farming community in Baltimore. And I think there was a third question on safety and regulations. And when I'm saying around zoning code is making it permissible to open a farm stand. And they still need to go with the health department for all related health codes. So that was a very zoning specific component.
Yeah, right in the back.
I talk really loud. I'm just wondering, do you have any information, or are you working at all on the idea of food co-ops and food buying clubs? It seems to be something that's gone past and maybe hopefully will come back around. If a lot of profit is being made from the SNAP benefits that are being given to private grocery stores, perhaps those profits could be turned back into the community with food that's for people, not for profit.
Do you have much on that?
I've only read, I don't know much about what's going on. I think there is a food co-op there's a food co-op in Baltimore, still fairly expensive, not necessarily affordable, but I think a lot of the literature I've looked at has shown there hasn't been a lot of success in low-income neighborhoods and food co-ops. That's like 3 studies, so that's the only ones I've read.
Yeah, I've been watching it nationally right now. There's been more and more chatter and talk on that issue. I'm still waiting to see some successful models. I know that New York City was trying one. There's been some other ones. I want to see a good model come across. And when we see something that's really valuable, and they may be there, so if anyone online has any great models of food co-ops and food deserts, I would love to hear about it.
Okay. We do have a couple questions from our online audience. I'd like to get those in. One is asking whether there's been any consideration for the role for rooftop urban gardening as a commercial enterprise opportunity.
That's me. So rooftop gardening is really valuable in cities where there is no land. We're not one of those. We have land here for farming. In New York City, that is where you're seeing the farms, is on the rooftops. We are seeing some rooftop gardens But I think that it all depends on expense. Is it more expensive or less expensive to be on a rooftop? So in Baltimore, where we do seem to have plenty of land for farming, we see more on the land than on the roofs. But it's not saying that there won't be some rooftop gardens. In our proposed land use zoning code, we did make rooftop gardening permissible, though, to encourage it.
Okay. And another one is noting that both the University of Maryland in Baltimore and Johns Hopkins on the East Baltimore campus are in or near food deserts. And wondering if either of you know whether there's been any attempt by either of those institutions to locate a large grocery store within walking distance of the campus.
I can speak about the University of Maryland piece. So Dr. Perman with University of Maryland is a part of the West Side Initiative, or I think the initiative's actually changed. Sorry, City University is called the initiative now, and it's a partnership between the city and University of Maryland around the whole West Side, where University of Maryland is housed, which is bordering in food deserts as well. And so within that initiative, one of the key strategies is to improve food access and food retail. It may or may not be bringing in a grocery store, but it's improving the food retail establishment along with the vitality and viability of the West Side.
And I think EBDI, which is connected to Hopkins and in the Hopkins area, has been looking at food retail and bringing more food retail to the area. I think there's still issues around what's considered affordable and would that help or not necessarily impact the community at all. I think I've heard people toss around like getting a Whole Foods or something else, and that probably wouldn't make a big difference if you're in a food desert and cost is an issue.
So I want to take one more stance on that question. That question was specifically about University of Maryland and Johns Hopkins School of Public, or Johns Hopkins, excuse me. But I do want to talk very quickly about Baltimore's approach to food deserts as far as a retail approach. So we have just approved a food desert retail strategy in Baltimore City. We looked at the model from New York City called New York City Fresh and are doing a similar model. Those details in New York City doesn't apply to Baltimore, but the concept was a really good concept. And so the main concept with it, how to attract grocery stores in food deserts, which is really what I hear that question's really getting at, is what we're looking at is financial incentives, obviously, but there's not that much money on the table. So it's just working with our existing financial incentives and tax credits we have, how to package them. But what we're doing that's innovative is we have 11 government agencies that has something to do with the development of grocery stores in Baltimore. And we have asked each agency to contribute 1 to 3 services that they can do in kind to help reduce the financial grocery gap for grocery stores. So when we take those 11 agencies' contributions plus the tax credits and tax incentives, we're hoping that we will then have a financial package that would be substantial enough to attract grocery stores into food deserts. And this kind of ties into the Public Health, PHA, Public Health for America. So I think I'm getting my acronym wrong. But it's the nonprofit that's working with grocery stores around the country who are committing to locating food retailers in food deserts. And so we're really wanting to see those stores that are already committing into food deserts to commit to Baltimore, and also for other stores that may be in Baltimore who need some financial incentives or support to locate in food deserts.
Okay. I believe we had some more questions right in the front here.
I have a question, one for each of you. So for Anne, you mentioned that small stores had higher prices because they don't buy in as much bulk as larger stores. But have you seen any difference in prices in chain stores that are in different neighborhoods?
That's a really good question. I don't know. I have not seen an instance where that has happened, but that would be something that would be very interesting to look at. And the reason I'd say that there probably isn't a great difference is because typically the circular, which is the promotional, the sales every week that go out through the newspaper, they're not going to change that for different neighborhoods because they print one circular and that goes out to everybody. But if not in chains, that's I don't think so, but I could be wrong about that.
You said that 24.5% of people in food deserts were on SNAP, using SNAP benefits. You said you weren't sure why, but do you have any idea? Do you think it's the qualifying income or just knowledge of the program?
Just recently, the mayor signed a memorandum of agreement for the Baltimore Partnership to End Childhood Hunger, and one of the goals is to increase our participation rate in SNAP benefits and also WIC. And so when we looked at those numbers for Baltimore City and also the state, our SNAP numbers were looking relatively strong for at least those with families. And so what my analysis, which I need to be doing, is looking at, I think our SNAP numbers may be higher in other areas in the city, but not necessarily in food deserts. And once we start to delve into that, we'll figure out, so the question that you're really asking is, why is that number low? And also I want to look at, is that number low? I want to compare it to other food deserts and see, is that consistent to other food deserts? It's a really new finding for us. We just figured it out around 2 weeks ago. Thanks.
Yeah.
Hi, Holly and Ann. Thank you very much. A lot of talks I go to, I leave deflated, but this one I think I'll leave feeling motivated that there's policy change being enacted, so thank you. I have a question, though, about energy balance, and energy balance is certainly the most proximal to overweight and obesity when we're talking about a public health problem. And so I hear a lot of promotion towards healthful foods and food access and food availability, but I guess my question is maybe larger, or maybe next steps, or looking and thinking about the private sector and the vast availability and access of unhealthful foods and unhealthy foods, and how we, or how you think we can combat that, or whether we should, or because I didn't hear that at all in the presentation, and just wonder if you have any ideas.
Giving that one to me. That, I think, is, obviously there are, we live in a capitalist country, and it's all about making profits. And it is not, we don't take kindly to regulating in the way I think we would need to regulate if we were considering, we just have way too many calories out there, we have way too much food out there, we have way too much unhealthy food. If you just looked at dose response from that perspective and said, how many times do you encounter food in a given day, and how many times, is it a healthy food choice? It's, and that's a huge part of it. And in some ways, I tend to not talk about obesity because I feel like we're obsessed with obesity, and that becomes the indicator that everybody's looking towards. I feel like we have to step back because there's so many steps before that we have got to reacquaint ourselves with food. We have got to just, there's really big system changes that need to happen for people to want to make different choices when they're eating. And those system changes have to be in place. So I like to look at it like this is a systems approach. Obesity is a symptom of what I call a dysfunctional food system, and that a symptom, of a dysfunctional food system. And it's the one we see, most, often probably in our work. And that, back that up and keep thinking about what is creating that, then it becomes a much more complicated problem than just energy in, energy out. I mean, ultimately, that's what you want to measure, but I think we really have to look at how are we going to change our relationship to food, and how do we start to do that from a policy perspective with some of the policies Holly's talking about at a city level, at a state level, and at a federal level. And what I think you find is the most interesting work going on around the country is really at the city level, because we have a lot more leverage. And you'll see people like Holly and people in those similar positions that are trying to figure out what's going to how do you shift these things around and change the equation so somehow we don't have this be just one more disparity that we're seeing. And we're seeing obesity in all income groups. It's growing significantly in middle and upper income as well. I think what you see is just the lack of access and the disparity between what you can do about it, affordability and things like that. So I don't think that answered your question, but I think it's, I don't know if I have the answer to that question.
We do have an online question that's a little bit of a follow-up to that, and it's a congratulations to Holly's office for all the great work that you've been doing, but a question about how much staff you have, or whether most of your work is done via partnerships.
So the answer is both. So it started off with my position. It was really grant funded in the beginning, seed funding from 4 foundations. I had a consulting firm prior to this, and I was actually on maternity leave when I took the position, and so 10 hours a week was great. And so then at 10 hours a week, I was like, wait, this is too much work for 10 hours a week. We need to secure some more grant funds. And so eventually I came up to full-time, and the community foundations were fantastic in supporting these efforts. Then the city actually decided to make my city a full-time permanent position in city government. And so when we went into city council to ask for the position to be a full-time city permanent position, the community foundations once again stepped up to the plate and said, okay, we're going to match you double plus your salary, so that when you go into really asking for this position, you're going to have some money to be able to hire staff and to really be able to make an impact. So that was like a great windfall. So I came out as city employee and had one full-time staff plus an operating budget, which was night and day compared to what I was doing prior to that. Since then, we've raised more grant funds. Now I have 2 full-time staff plus myself. But as you know, that is not enough. We do a lot of work, and we do the work because of Food Pack. And with the 35 organizations, it's an army. We have an army in the city who's working on food access issues. And then within, really the leadership of the mayor, most of the agencies in Baltimore City are supporting these efforts in so many different capacities as well.
Great. I thought I saw some hands way in the back over there.
This is another unanswerable question, so maybe you should just call it a comment instead, and I'd like a reaction to the comment. You were talking about earlier, Holly, about how SNAP benefits, they actually help retailers because the money ends up in their pockets too. But I was reading this morning actually that 75% of the people who get SNAP are employed actually. So not only is it a benefit to our subsidy to retailers, but also to a lot of employers who aren't paying a living wage. So I guess if you turn this into a question, I'm just curious if that's part of the conversation, the idea of a living wage, and how, when you talk about affordability, there's 2 sides to it. One is, what is the price? And the other side is, what is the person's purchasing power? And of course, that is driven mostly by what their income is. So I just wonder if that comes up in the conversation, say with your food pack or any of that.
So I'm actually really glad you raised that comment just now, because your figure you just mentioned is actually consistent to our figure, because we said 82% of the residents living in food deserts are employed. So that's consistent. Now I know my SNAP number is a little lower in the food deserts, but the fact that there's such a high employment rate, which is why we really need to have a food desert retail strategy, because it's about job growth along with food access. It can't just be one or the other. And so when we're talking about job growth, yes, with the grocery stores and developing grocery stores, you see your construction jobs, which has a certain wage associated to it. And then in the grocery stores, there's also another wage associated to that as well, whether it's full-time, part-time, whether it's manager or clerk and so forth. But I think that there's a lot of opportunity for job growth in the food sector. I want to use Boston as a quick example. Boston has had this transformation of food trucks. But what was interesting with the food truck culture in Boston was that it created over 200 jobs, new jobs through food trucks. Whether it's a food entrepreneur who developed their own business concept, they were probably highly educated and had the skills and the business plans, but then they hired a whole bunch of staff to help them with their food trucks. And I think that there's many ways that we could be looking at food sector jobs and hopefully start to change that price point, because they notoriously seem to be a little lower than we would like to see them be. But since food seems to be, we all eat a lot of it, as we know, it sure would be nice that people could actually make money off of food as well.
Okay.
Hello, my name is Chris. I'm with Streetwise Foundation. We're based in Washington, D.C., and I'd like to share a quick anecdote. Okay, we do a lot of youth outreach programming, and one of our programs that we do is nutrition, and did a great program with a bunch of 13, 14-year-olds. And 2 days later, a parent comes into, and she's very upset, okay, and we're like, whoa, what's going on? So she's like, well, I don't appreciate what you told my child and all this type of stuff. And, of course, I'm the executive director, so I'm thinking that there was an issue. But turns to find out is that parent had an issue because, of course, we did our programming, and when she went grocery shopping and she brought home the groceries for the child said, I'm not going to eat any of this because it's unhealthy. Okay? So I was like, why are you upset? This is great. I understand the fact that, you wasted, X amount of money on food that the child's not going to, engage in, but, you should feel proud. But what the conversation turned into was that the parent, obviously overweight, was using the child as an excuse to engage in that type of food and that type of behavior, okay? And that was like the staring into the abyss, so to speak, because not only is it the fact that, we provide not only great programming, great food, great all these different opportunities, but at the end of the day, it's a lifestyle situation, and that a lot of people aren't ready necessarily to engage in that or come to grips with their own inner dark secrets, so to speak. So, and I think that's one of the things that it's kind of like a top-up type approach, because we can provide all these great things, but at the end of the day, if they don't want them, or if they're not ready to expand their horizon, so to speak. And the reason why I say this is because I know in D.C. There's a growing Muslim population, and they're located in a lot of these food deserts that we have in Washington. And what has happened is that because of the lifestyle has changed in a lot of these neighborhoods, a lot of the food desert convenience stores, Chinese food restaurants, fast food restaurants have changed, because that is what the community wants. So what's happening is that now they're starting to do halal, which is like, I guess, the Muslim, kosher type situation. So I see it that the neighborhood can change, what is being offered as far as food. Definitely with the food truck situation, we have that great in D.C. But from our perspective, as far as service providers and things like that, from your perspective, how do we start to engage in the actual, the lifestyle change that has to happen? And what's your thoughts on that?
I've heard a very similar story from a woman we work with, Antonia Demas, who does a Food for Life. Food is Elementary program with kids, and a parent called up and said a similar thing. Is now, and her issue was she couldn't afford the healthy foods, and they were creating demand for this food, and she didn't want it. And it was like it just pained her to know, that she couldn't provide for her child what she wanted. And I think that the behavior change part of that is it is a slow-moving train, and that the more, just as we have been exposed to so many unhealthy foods, the more exposures, the more opportunities, the more chances you have of incorporating parents into the programming, having community dinners for them. That's part of the Food Elementary program, and really recognizing that we may never get people to make a lot of the changes that they know are the best changes for them. That's a tough nut to crack. And I think about Jeffrey Canada's work in the Harlem Children's Zone, and he works with the parents of the kids, but he has basically said, I cannot afford to go and try and start with and he doesn't say I'm not going to do anything about their parents, but basically I can't afford to put my resources into the parents. I have got to work with the kids. And so, as much as kids can be gateway, their behaviors can be gateways to the family, vice versa, the parents' behaviors are also gateways. But I think, I don't think there's an easy answer, but I think it is just this continuous idea of you've got to have, multiple ways of interacting and influencing and getting them to participate in, and maybe it's gardening at home, maybe it's something else, where they start to recognize that there's some things that they may be able to do, and make it really simple. We start with very simple things in a lot of our programs, recognizing that people aren't going to make big changes overnight, and that part of it is just this slow process. No funder wants to hear that. Everybody wants to hear that. Oh, so you're going to stop obesity? Oh, sure, I'm going to stop obesity in 3 years. We're going to be able to, like, hello. How long did it take us to get here? And there's got to be a recognition that there's a whole system in place that works against us making good food choices every single day. Every time you walk out, you don't have to walk out your front door. Look in my cupboards. My God, there's all, look in your own, that there's just all these opportunities, and that is not going to change overnight. So.
Okay. Well, on that note, I think that wraps up our presentation for today. Again, I just want to give a really big hand to Ann Palmer and Holly Firstep for a wonderful presentation. And thank you all, and I hope we'll see you next month for our next presentation on reducing asthma disparities in children. Thank you.